Sean here, CEO of Talk2 and co-host of this podcast. We don't normally do this, but on some of the episodes moving forward, we're going to be introducing some ads before, during, and at the end of each episode. We promise we'll keep things short, but my company Talk2 has been saving veterinarians like you time every day. And I wanted to share some testimonials from our users. Listen to them or fast forward. We'll be sure to keep it brief.
You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Sean Wilkie, and along with my awesome co-host, we interview the innovators in this space every week. Ivan, please kick us off.
Hey, I'm Zach, and I'm excited to introduce a colleague of mine, Dr. Lisa Lippman. Lisa is one of the most followed and socially influential veterinarians in the United States. She is nationally respected by media outlets such as Dr. Oz, Inside Edition, and Live with Kelly and Ryan as a go-to source for expertise in pet health and safety. When not treating some of the most influential pets in the world, at Bond Vet, she sits on the board of Animal Lighthouse Rescue, whose mission is to help the homeless dogs of Puerto Rico, is the co-founder of the Pet Loss Community and Senior Dog Vet Society. Lisa, welcome to the show. Thank you for finding the time.
Thank you for having me.
So tell us about your main occupation right now. So this Senior Dog Veterinary Society, what is it about? What's innovative about it? And what do you want to tell our listeners?
Yeah, so the Senior Dog Veterinary Society was co-founded by me, a veterinarian. I've been practicing about 11 years, and my co-founder, Dr. Monica Tarantino, who is also known as the Senior Dog Doc on Instagram. She does everything senior dogs, and we kind of came together and said, hey, we love senior dogs. And then we found our co-founder, our third co-founder, Dr. Lauren Edelman, who all love senior dogs. She is a board certified veterinary internist practicing at the largest hospital in Vancouver. And we all came together and said, we love senior dogs. About 2023, we made 7 CE credits courses for veterinarians to take. And within 48 hours, we had about 100 veterinarians sign up. And we said, hey, there's real interest here, right? I mean, if you look at the way human healthcare is, they have board certifications in geriatrics. In vet school, we don't have even a class on geriatrics. And, we have all these set puppy protocols where we know what to do for a dog up until their first year of life. And then they're no longer puppies, but we don't have any kind of protocols or set standards of care for senior dogs. And so we wanted to come together and really elevate the standards of care for senior dogs and do that through education for veterinarians. And so we came together, we co-founded this. The basis of it is a 14-hour CE race-approved CE credits that veterinarians can take, and they become senior dog certified, much like fear-free certified, but instead senior dog certified. And I say that with a lot of love because we very much have partnered with Fear Free. We've done a lot of initiatives with them. So it's a great adjunctive to that. So yeah, it's a great way to just elevate the standards of senior dog care.
That's awesome. I have some questions. So it's so easy to recognize who is the puppy and how old is the puppy. How do you recognize when the dog becomes senior? And I mean, in human, we are all one species, and give or take, Sean got older earlier than me, but give or take, we get older at a certain age. If you compare Great Dane to a Shih Tzu, when is the senior age? When is it recognized? And how do you approach that?
That's such a good question. That's one of the things that we go into because it is so different for different dogs, different breeds, different ages, different sizes. And that's one of the things that we address. One of the systems that we broke down that Dr. Monica Tarantino coined was sort of looking at the early senior, the classic senior, and the geriatric senior. Most practices these days really consider seniors at around 7, but we know that that's not true. And we encourage people to be really proactive about their care. And it's definitely one of the things that we go into depth breaking down in the courses. So
That makes sense.
have to take it.
Yeah. Ivan, you can always use to get a little bit smarter, so you should totally do it. Dr. Lisa, a couple questions for you from me. So when you guys came together and you wanted to increase awareness, what's the vision for your guys' organization? So you've got this credit, you're getting it out there, I would imagine, but what are you guys looking to do? Are you guys looking to just provide more education for the industry, or is there a business behind this? Is it a nonprofit? Where are you guys going? What are you doing?
It's a good question. It's not a nonprofit, it is a business. Really, our model is very much based on fear free. So, a lot like they do, we are, a certification course. And really, the mission is to elevate the standard of senior dog care. We're just veterinarians who absolutely love senior dogs and know the plight. When a senior dog comes in and people go, is this old age or is this disease? Can we treat for the treatable? And we talk about things like what's the difference between a senior and a geriatric? What is health span? What is lifespan? There's so many just basic definitions that I think I didn't even know until doing deep dives into these things because I love these topics. So, and then, maybe the vision is in the future board certification, whether we have a hand in that or not. But like I said, I think veterinary medicine is really going the way of human medicine, and our geriatric patients, our senior patients, really deserve more.
That's so interesting. And, I was just thinking that it would be kind of cool to be, as a veterinarian, when I'm on the floor, to say I am senior pet certified. And it's kind of like it gives a little bit add to your title. And when I think about Sean, I'm just thinking about what is the difference between geriatric and senior?
That's exactly right. So, one of the things you said, though, there I do want to touch on was that we also have a directory on our website for pet parents because it is really important for pet parents to be able to find senior dog loving veterinarians. And so, I just want to touch on one point that you made also, which was about we have a directory as well for pet parents to find senior dog certified veterinarians. So I think that's really important to be able to find a vet who will take the time and love their senior dog like we do. In terms of senior versus geriatric, also something we go into in depth in the course. But in general, a senior dog is a dog that's older in age, but still relatively healthy. And geriatric, when you're talking about geriatric, you talk about the older population of senior dogs, and you start to think about frailty with them. So, frailty is a whole nother section of information that we go into in the course as well. In humans, they use frailty scores to define morbidity and mortality. And it's really not something that we take into account at all. Again, and not even a term that I had heard. And there is some research going on it now in geriatric dogs. And so I think that's going to also be something really important for us to focus on in the future.
Dr. Lisa, super cool. I mean, it's, one of the things that we have the chance to do as the co-host of the show is meet people that have passion. And it's coming through like the video and the audio for our audience and for us to receive, which is really cool. How are you guys delivering this CE? What's the technology? What are you using? How do people sign up? How much does it cost?
Yeah. So they can go to seniordogvets.com. And so it's all through the website, it's all virtual. So for the senior dog veterinary certification, again, it's 14 and a half hours of race approved CE credit. There's two levels to the certification. Everybody, veterinarians, technicians, kennel assistants, receptionists should really be taking level one. And level two is really more for the veterinarian and veterinary technicians where they really want to like do a deep dive and get into that. All encompassing, it's $349 for new members and then $199 per year for renewal. We often have, though, certain sales or discounts going on. So definitely make sure to follow us as well on Instagram at Senior Dog Vets, and you'll get all of the latest there.
I think it has so many applications, and now that I'm thinking, when I'm in an exam room, and also the partnerships that you can think of on, on to certain medications and the diagnostics. And have you thought already? There's all kinds of puppy plans that you have in the clinics, especially in the general practices. Have you implemented or talk about in the course about the sort of the senior dog plan as the wellness plans?
Veterinary records don't just take up time at the clinic, they can follow you home and weigh on you on your weekends. Talkative is here to change that by helping vets reclaim their evenings and weekends. Dr. Mary Van Cooey shares how Talkatoo helped her find more balance in her life.
And I do have to say, it saves me the most phenomenal amount of time, not only in the phone calls, but in the notes as well. Go bird watching, be with my husband. I mean, I usually on the weekend would set aside at least a half a day that I just had charts on my mind. I have to do it. I have to do it. And it just weighs on you. Now it's like, if I can do some during the week and it's not a crazy, crazy week, sometimes it only takes me a half hour now.
Get full access to all of Talkatoo's powerful features for your first month for just $1. Sign up today at talkatoo.com/VIP. That's Talkatoo, TALKATOO.com/VIP.
Yeah, it's actually an entire, so not only do we touch on like what diagnostics we should be looking at, what blood work we should be looking at, but we also talk about how to handle senior dogs in the clinic. So we take that fear-free component, and we also talk about, well, if you have an older dog who has some degree of arthritis, right? Because we know even like 80% of dogs over the age of 2 have some degree of arthritis. Now you're talking about seniors. We don't want to be dragging them through the clinic or cranking on their neck to do the blood draws. So simple things like, putting mats down. Yes, that's the fear-free way. But now what are the extra steps that we can take for the seniors to make sure that we're not only, treating them the best medically that we can, but also mentally. So
That's cool. So, Dr. Lisa, it sounds like you guys are going to just continue to grow this content as the knowledge grows across the industry. And it sounds like, we could even see wellness plans that were targeted at senior dogs in different categories. Do you have a future vision for the direction that you guys are taking this initiative?
yeah, well, I think it is going to be really important to have things like consensus statements and recommendations for veterinarians to practice because, like I said, there is no set standard of care. We know with the puppy protocols, you do, your distemper parvo every 3 to 4 weeks until a puppy is 16 weeks old. And then we go, oh, seniors, oh, well, come back every 6 months for maybe blood work, maybe an ultrasound. What's the standard of care there? What are we really looking to do for these patients? And if we have an owner who wants to do everything, what does that mean? So without because obviously it's not just about doing all the diagnostics, but it's about doing the right diagnostics at the right time. And so that is important. So yes, we are looking to set standards of care and have standards more set in place, including those kind of wellness plans, more with stronger recommendations than just come back every 6 months.
Have you thought of any sort of a breed specific care as well in seniors? Because there's predisposition in certain breeds to certain conditions that you should be watching out for. Is there an angle that you guys are taking on that way?
Yeah, I don't know if so much we've thought. I mean, just in terms of age, right? Like the larger breeds are for sure prone to having a shorter health span and lifespan. So, from that regard, for sure. I think if anything breed specific comes up, make sure to mention it. But we really do focus on specific areas of the senior dog. So, for example, we have like a whole lecture on ophthalmologic diseases in senior dogs or neurologic diseases in senior dogs. We have a whole course on anesthesia. Dr. Katie Bennett does a ton of anesthesia talks for us, right? It's one of the things that I think gives us the most heart palpitations is senior dog, anesthesia. And when do you make that decision, for a geriatric dog? If you have a 13-year-old dog that needs to go to surgery, how do you make those decisions? And we have some really good pointers in the course for how to do that.
We had a couple of guests recent, well, not only recently, but throughout the last couple of years, that there's so much innovation in the screening for cancer. And it's always, something that people ask, like, is there a cancer test? Because there hasn't been, but now there's so many things that are erupting. Is there anything new that you see in the recommendations of these, anything in that direction?
It's a really good question because one of the things that we talk about is having validated scales. There are validated scales and there are not validated scales. And for example, we talk a lot about this concept of quality of life. But when we talk about quality of life, we don't even have an agreed upon definition of quality of life in veterinary medicine. So it's very hard to make a validated scale around that. There are lots of scales, right, that I think are really helpful for owners. And we still should use those, but we need to know what are sort of the more validated scales and what are the less validated scales that we're using. And so quality of life is one of those things. And then
And then, so on the quality of life, if I may, what are the measures of quality of life? Because I know that in approaching the oncology in the veterinary medicine, the way that I describe it to my patients or their parents usually is that, we're trying to use the same chemo drugs and other medications to fight cancer, but we don't go to the extreme that we do in humans because we want to preserve quality of life. So, in your definition in senior animal, the quality of life, how do you guys define it for seniors?
yeah, well, I mean, I think we do use scales for those. Again, they're less kind of validated because we don't have an agreed upon definition of quality of life in veterinary medicine. But one of the scales that we look to the most is called the scale by Dr. Alice Villalobos, and that measures things like hurt, hunger, hydration, hygiene, happiness, mobility, and are they having more good days than bad? And so we talk about a few different scales like that. Ohio State has also a really great scale. So we use those scales to help guide us for sure. I think that's one of the easiest answers I can give you, but we also have an entire CE lecture on that too.
There we go. So, how do people find you and how do they find the CE courses and sign up?
So they just go to seniordogvets.com and get certified is right there on the top in pink. And that's really that. We have all kinds of resources. So not only is it the 14 hours and the certification that you get, but there are live CE events, there are extra CE courses, there are roundtables with specialists that we have all the time. So, or find us on Instagram at seniordogvets.
And we ran out of time, so we always do. Got a couple questions to wrap up. First is a book, a YouTube video, something that you found inspiring on your journey so far.
Oh, just pick any of those? I think there is a TED Talk by Dr. Horowitz. She's a human cardiologist, and she talks a lot about capture myopathy in pets and like the study of heartbreak and how it's very similar. So when you well, I'll just kind of leave it at that, but it's really, really interesting. So I would definitely look up Dr. Horowitz and her lectures on rhabdomyolysis and capture myopathy and how they're similar in humans and people, and the study of really how heartbreak can kill you.
Okay, interesting. And the second question that we usually ask, is there another innovator in this industry that you would recommend to this show?
There's so many innovators, and I'm afraid that you've had some of them on the show already. But let's see. I mean, Bruce Truman for sure. My co-founder, Dr. Monica Tarantino, who also co-founded a pet loss and grief community. The guys at Radimal, right, who are doing AI in imaging. It becomes a very small world. I would say maybe Dr. Philippa Pavia. She is a board certified veterinary surgeon and she is in Leadership Thrive. And she's doing all kinds of innovative things there, helping them lead the way, in the veterinary space. And so she'd probably be my next.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinaryinnovationpodcast.com. See you next week.
Thanks for sticking around to the end of the episode, and thanks for being here. As I mentioned earlier, Talkatoo has a special offer for listeners of this podcast. If you're curious about how it works, Talkatoo is a suite of AI tools that makes note-taking faster and easier. You can record your entire appointment and get a SOAP note within seconds, completely automatically. Just review and approve. That's all you need to do. We also help with call summaries, discharge instructions, and many, many more. All of these things are done within seconds. Get full access to all of Talkatoo's powerful features for your first month for just $1. Sign up today at talkatoo.com/VIP. That's Talkatoo, TALKATOO.com/VIP.